So my patient case that I chose was Bonnie Martin, who was 66 years old, and she had a left transtibial amputation, which was most likely the result of type 2 diabetes, which also led to a lot of underlying health conditions as well as the transtibial amputation. But the transtibial amputation is what we're going to focus on today because that is what we're trying to provide her therapy for. So, due to her transtibial amputation, she cannot walk, and in order to discharge her and get her to her goal of going home, we would have to have her go home with moderate assistance for her to be safe and discharged to go home. And she would get the moderate assistance from her boyfriend, but he can't give her maximal assistance because he also has to help himself, and he also has some underlying health conditions that he needs to focus on for himself. So some of her personal and environmental factors where she lives, it's in a mobile home, and it's not safe for her to navigate that for her, and especially if she's maximal assist because she cannot walk and she just had a transtibial amputation. So another personal factor is that she has two kids, and they both also have diabetes, and they both have obesity. And yeah, she lives in a mobile home, so that's probably why it's dangerous. It's probably why it's dangerous for her to try and navigate her mobile home by herself without being able to walk. And there's like it increases her risk for falls and stuff as well. So a bias that a healthcare provider might have is that she has depression, even though they're not sure, because she just had a transtibial amputation, and this lady has been through a lot. She has a lot of underlying health conditions as well, and it even says on the case that her some of her caregivers want her to go to an evaluation because they believe that she has depression. She kind of gave up on trying because she thinks it's already too late for her because she's already had that transtibial amputation, that she doesn't try to manage her diabetes. And so a bias that we may have is that she's not trying to take care of herself. So why should we try and motivate her and try to take care of her if she's already smoking 2 packs of cigarettes a day? She obviously wasn't a good mom because her kids have this, and they might think stuff like that. But at the end of the day, it's not our job to judge. It's our job to provide good care. And on top of that, we have to be more empathetic and loving towards people because we know her name and her patient case. We don't know her story. We don't know what she's been through when she grew up. We don't know any of this. So we just need to be empathetic and loving towards people, And to get over that bias, I would say, just provide good care and motivation to the patient and do not judge her because that is not our job. So in order for us to enhance patient outcomes and limit any barriers would be to motivate her and talk to her and see what's going on and what works and what doesn't work. So maybe motivating her in one way doesn't work, but maybe when her boyfriend gets there, she gets excited or happy, or kids, and she wants to try. So maybe using that to our advantage. Also showing her maybe videos because she thinks it's too late for her to try because she already had her transtibial amputations. We can be like, it's not too late. You can still walk one day and go. You want to go home. You need to do this. So we can use that to our advantage to try and get her to enhance her outcome and do her exercises. Like, you could walk again with an assistive device, And a way to optimize her patient's safety and accessibility is showing her how to use her any assistive devices, and on top of that, make sure that she knows how to use it and she knows how to navigate it, and make sure she can independently use the assistive devices on her own in order to go home with moderate assistance from her boyfriend, most likely. You can also practice with her boyfriend there at the rehab facility that she's going to be at. And one local community resource that's really important that I feel like would help her, I would say, is going to church. So church always has help, especially the church I go to. We had a care team that would help anybody who was special needs and had any disabilities. We would let them come in early to church and make sure they are seated before anybody else. And they offer help around the community too. Like she would be able to ask around, and she'd be able to live more in hopefulness instead of hopelessness, because that is what churches help you to do, is to live in hopefulness, not hopelessness, especially when you believe in God and all that. So I feel like going to that, like they have support groups there too at church. So like she's going through anything, they have counseling and other stuff, so she can ask about that, and they would definitely help her, and her family could go to church with her as well too. I will assist the patient, especially if she feels like it's too late. I don't feel like anything is ever too late. If you're still alive, you're still here for a reason. Obviously, you still have a purpose. You're not done yet. So church really like reading the Word of God literally helps you to do that. And so maybe she'll try more, want to not give up and manage her diabetes, because she'll find more of a purpose. So especially if she has children and stuff, like they will preach that to her. So I really believe that most local community resource that she go to is the closest church she has to her. And if she doesn't like that church, there's another one. Like she doesn't have to be at that one. So a lot of people believe like, oh, I went once and I didn't like it. Like there's other churches. So and she can also look online. They should provide resources and help for churches. And like, let's say she can't change her trash can, and the church will find somebody to go to her house and change her trash or help her out for her, you know? So I believe like that's the most important. So the church I go to is Crossroads, so I personally would have recommended that church to her, but depending on where she lives and all that, then I would recommend something else. I would recommend a closer church to her. So yeah. No, so she has a transcerebral amputation. She needs to be able to be moderate assistance in order for her to go back home. We should not be biased towards her at all, or judge her. And if anything, we should love and motivate her and have empathy for her, because we don't know what she's going through. She just lost her leg. Have some empathy for this lady, you guys. You know, like I would try, as a healthcare provider, I personally would do that. And for her to just keep going and motivate her and go to church. So yeah.